Okay, so for piggyback IV, I'm gonna need my secondary tubing and then my piggyback medication. And the thing to hang it from.
Perform hand hygiene, 60-second assessment, assessing airway, breathing, circulation, tubes, lines, drains, and the safety of the room. ID your patient, and then check the vitals.
Okay, so now I'm going to get some gloves on so that I can inspect the site. I already have some sodium chloride running through this line, but I just want to make sure that it still looks good and it's clean, dry, and intact. So now I'm going to take my gloves off and throw them away. Do some hand hygiene. Before I start with my piggyback, I'm just going to program the pump because now I have an order to from the GTT per minute to 30 mLs per hour. So now I'm going to get ready to hang my piggyback fluid, my vancomycin. I already checked for compatibility with the sodium chloride, and it's compatible. So I'm going to spike this. So I'm taking this brand new tubing out of the package, and I'm going to clamp it. And
like if the bag's 1,000.
Then I'm going to make sure that I am keeping everything clean. So I'm going to take this out. That's the blue cap. Take this off. And then I'm going to spike it.
I guess it's something also maybe to do with more that the sewage pumps rather than like what you'd actually do in a circumstance of.
Okay. And then I'm going to take this and I'm going to hang it up here. And I'm going to take these fluids and hang them on here.
Okay, so
and then take this one and hang it up here.
Yeah, because you didn't give nothing.
Okay, so now I'm going to take an alcohol swab so that I can scrub the site that I'm going to be putting the piggyback tubing into right here. So we're going to scrub this for a good 30 seconds. That was 30 seconds. Making sure that we're keeping everything clean.
Okay. Alright. So want me to try to find
Okay. And then making sure that this is unclamped. Now we're going to prime this by using gravity. So I'm going to take this off now and put it lower than that one. And then I'm going to unclamp it and let the fluids run in. And then clamp it. And I'm going to put it up here. And then I'm going to set my... Okay, so now I'm going to set up my secondary on here, which is vancomycin. And then we have 1,500 milligrams and 250 mLs. Just gonna compare it to the bag, and that's yes. And then gonna hit okay. Secondary bag. And then it automatically puts in the rate for us, so 167 mLs per hour is going to be 250 mLs, so we're going to hit start.
This is when, so it's an IV piggyback.
Oh,
so I don't have
we're going to hit okay. 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 And then we're going to hit.
But isn't that like a tandem?
And run.
Like this is
and then we're going to check to make sure that
It's still in there, the blue thing.
We're going to undo all our clamps and push run. And we have drops flowing. I saw one.
Yeah,
it's going. So we're going to hit yes, and that's it. Now I'm going to do hand hygiene, and I'm going to make sure my patient is comfortable, and I'm going to make sure their bed is in the lowest position. They have their call bell within reach, and document.